You are welcome to this part 1 presentation of mental capacity, the Masterclass Psychiatry. I'm Dr. Prosper Tettey in the United Kingdom. In this presentation, there will be capacity assessments based on a case scenario of patients, and we'll talk about the 4 elements of the content of mental capacity assessments. Now, the case scenario is you have been asked to interview a man who had been brought to hospital with hematemesis. He needs endoscopy but is refusing. Assess the patient's mental state and the capacity to refuse endoscopy. The patient has psychotic symptoms. He has a delusion that by doing an endoscopy, the surgeons are trying to put a spying device inside his body. So, how do you go about this? This station is about assessment of mental state, which includes assessing for psychotic symptoms, mood symptoms, phobias, anxiety disorder, including OCD. Patients may refuse interventions due to fear of contamination, etc. Now, capacity assessment includes, according to the Mental Capacity Act 2005, a person lacks capacity in relation to a matter if at the material time he is unable to make a decision for himself in relation to the matter because of an impairment of or a disturbance in the functioning of the mind or brain. It does not matter whether the impairment or disturbance is permanent or temporary. A person is unable to make a decision for himself if he is unable, 1, to understand the information relevant to the decision, 2, to retain that information, 3, to use or weigh that information as part of the process of making the decision, or 4, to communicate his decision, whether by talking, using sign language, or any other means. In this scenario, the patient lacks capacity due to his mental illness affecting his decision. The next part of the assessment is to determine if the patient has a lasting power of attorney or next of kin whom you can contact. And also ask this question: is there an advance directive available? This brings us to the end of the presentation, and thank you for your attention. And if you are interested, you are invited to subscribe so you receive future similar presentation. I wish you all the best in your career. Bye.